So as I was talking about, these are a high residue or a high fiber diet. You can see this is really going to be to add bulk to your stool and help speed the passage rate. It's really going to be fruits, vegetables, legumes, whole grains. I want you to think about what other diet diseases will benefit from this diet modification. So remember that what we're talking about here is for constipation, diverticular disease. This is going to be insoluble fiber, but the soluble fiber is going to help with heart disease and diabetes. It's going to help reduce the serum cholesterol and blood glucose. It's going to uh, help with what am I trying to say? Not homeostasis, but similar to that. It's going to help with prevent spikes and big dips in blood sugar by having a diet high in fiber for the diabetic. All right, now let's talk about the exact opposite. When might we put a patient on a low residue or low fiber diet? So if they have GI inflammation or scarring, this is going to narrow the lumen or the opening, as you can see right here. Um, and also maybe they have enteritis, which is an inflammation or an infection of the small intestine, and that can be caused by viruses, bacteria, or protozoa. If it is severe enough, we might actually have to make them NPO. Lastly, they could also have a bowel obstruction. So things that are on a low fiber diet, you can see is going to be bananas, white bread, cereals, pasta, um, low fiber food we're talking about. Things that we also want them to avoid though here is going to be also fried food, highly seasoned, whole grains and fiber obviously. And we're going to have them actually limit their dairy to 2 servings a day. You can actually go in your book and look at table 17.4 and it'll really review that further. Then here's the bland diet, aka the brat diet or the brat diet, whatever you want to call it. And it stands for B, banana, R, rice, A, applesauce, and T, toast. You can see here are many of the reasons we use this, these type of patients. We also usually like to do small frequent meals are often better tolerated. Um, and usually, you and I have probably already put ourselves on this diet more than once for a couple days. And usually after 2 to 3 days, you can usually tolerate progression back to a normal diet. The other thing here is this, when this person, anybody who's having diarrhea, hydration is going to become a primary concern, and they may actually need some oral rehydration solution if it becomes severe enough. This is actually very timely with the Ebola outbreak because that is actually one of the things they do is they have a lot of profuse diarrhea and they get dehydrated. And so one of the big things is keeping those patients hydrated through IV fluids and rehydrating salts and solutions. All right, the rest of these slides are just going to be um, multiple choice questions, so just please go ahead and stop the video as you try to answer these. I'm not going to be talking for the rest of these. I'm just going to wait a couple seconds and then click to the next one. And then lastly, if you want to go ahead and go through this is just another little case study I had. If you have any questions about what the answers are, if you want to verify your answers, feel free to email me or we can set up a meeting with me. I'm more than willing to go through these with you. Do recall I am going to send you some more of these multiple choice questions, clicker questions that we just did not get to in class um, sometime before the assessment. Have a great night and keep up the good hard work.